Welcome to the In Season podcast, rated R for language.
None of us are doctors or neurologists. The things you're about to hear are opinions of people living with epilepsy or seizures. These are firsthand experiences. Epilepsy can cause speech problems, and the medications are hard to pronounce. So please bear with me.
Epilepsy can cause bad memory, so some stories will be repeated. I'm Pookie. Get ready.
This was so funny, guys. I was outside having a cigarette and I had the notifications on. So I got that motion notification and I'm looking and there's Athena and my pillows are flying off the bed and she's nesting, right? And it has a microphone. I can talk through the camera.
Yeah.
I'm surprised she didn't wet the bed because she turned into this statue all of a sudden. And she was looking all over the room and I couldn't stop. I just couldn't stop tormenting this poor dog. I'm like, you can't find me? Am I over here? Am I over there?
I do the same thing with my dog. He's like always looking, and I'm like, get off my bed. And I'm not here, so.
Oh yeah, a little bit of fun, but haven't seen anything frightening yet. I'm just not sleeping, and I know why. We all know why. I mean, we couldn't get my arm back into the joint the other day, and we almost had to go to urgent care. Urgent care won't touch it. And I'm like, so what do I do? Well, you have to see an orthopedic. I already did. Well, you probably need surgery. And she's looking, you need surgery, but they won't do it. So they said, I have to learn to live with this. You can't. Okay, will you tell them that? And that was over the weekend. And I'm like, I'm so tired. So last night I was sitting here on the couch and my daughter heard it before I felt it. And she just went, not again. Yep, there it goes again.
Right. There it goes again.
Yep, it won't stay in the joint. And I'm like, okay, well, oh well.
And they just expect you to stock up on ACE bands? I mean, that's not even going to help.
How do you put an ACE bandage on a shoulder?
That's what I'm saying. What do they expect you to do?
Right, and my insurance won't approve any more injections or physical therapy. They already approved the surgery, and this doctor just won't do it.
What are you thinking, Rick? You're still muted.
How did I do that? Okay, sorry. So first of all, with the Depakote, I had felt so much muscle fatigue, like I couldn't even bring my arm up to sign a birthday card. So yeah, that's definitely, I think, yes, you'll get sleep because you'll be fatigued, but I don't think it's worth it. What led your doctors to think that you had liver disease? If I missed that, I'm sorry.
In 2023, I had to have emergency gallbladder surgery. And the primary care provider that I was seeing was suspended. So I had to get another primary care provider right after surgery, like within a week. And this person that I was referred to, I thought, okay, this will work, for now. Her main focus was Ozempic, my weight. She never even did, there's two missing post-op evaluations, 2 concussions and 2 strokes that she never submitted evaluations for. And I was questioned about that. And I'm like, yeah, no, she never did any of that. But she wants me to lose weight. And it turns out, and I could be wrong. I took it personally then, because of the way they talked to me. She sent me in because she felt that I had what she called tortuous veins of the spleen. If you did anything past Anatomy 101, you know that that's a normal and desirable occurrence. Okay. But she said, oh, well, after gallbladder surgery, this, that. And I'm like, that is anatomically correct. I am not worried about that. Well, your weight, this, that. I go to see this specialist who wanted me to get the MRI, but he said to me, you know, you don't start losing weight, you're going to need a liver transplant.
Oof.
You've got fatty liver disease. And I'm like, I don't know what's making y'all think this, but I'll go do the test. I don't understand all of the hepatic and, you know, that stuff. I'm more anatomical where it comes to the spine, the joints and such. But I didn't understand all the terminology, and I'm looking at it and I'm like, this doesn't really sound that bad. And I just let it go. Still lost 30 pounds, still, you know, moving forward until yesterday when my oncologist tells me, whatever made you think you have liver disease? And he was able to look at that MRI right then. And he's like, oh, I've got words for your primary care provider. Okay, can you send me a copy? You know, so it's like, okay, I do not have scarring or fatty liver. I have a normal liver for someone my age who never used alcohol. That's it. So
Yeah, but I was curious.
yeah,
because
but yeah, the Depakote for your reason, Rick, I'm like, yeah, on the fence because I'm more likely to get injured when I'm that fatigued.
mhm.
So that is like, yeah, that's part of the conversation. That's why I'm doing this. It's like, yeah, I really need to make an informed decision, and this is amazing that you guys are helping me do this. But yeah,
I think Kevin's been on Depakote or is on Depakote right now. But
yeah,
Yes, I am. And it's been a trouble in the past. I've had issues with fatty liver, and it's under control now. I haven't had a blood test in a while, and I'm hoping, I don't think several years I've had a blood test, but hopefully they'll issue that in my next appointment in December. I'm hoping they'll. It's good now, my recent blood test, but
and it doesn't
we'll
make
see.
you, yeah, but you're not like lethargic or incredibly fatigued.
Oh, yes, very, very fatigued. It's difficult to get projects started, and it's difficult to focus. Very difficult with concentration. I'm also on clobazam, which and pyramid. They affect that as well.
Yeah.
So yeah.
Yeah, clobazam. I could not.
I
I can't
stopped taking that 2 days ago. I've been
Yeah.
weaning myself off for 4 weeks from 20 milligrams twice a day, just cutting it in half every week, and finally stopped it 2 days ago. And I can't tell my family, but I do feel better,
Yeah,
more
right.
aware.
Right. Yeah.
congrats.
I'd rather have the pregabalin back, but you know, yeah. Oh, who did we lose? We got somebody new in.
Right.
Okay.
All right, welcome to any newcomers. Usually the first questions, if you're up for it, is what medications you're taking, when were you diagnosed, and when was your last seizure? So feel free to jump in anytime. I'm Katie, by the way.
Oh, I love it. I mean, when Kate takes over, it's great.
Just want to practice. I'm telling you, off the clobazam for 2 days. Usually when I stop taking medication after 2 days is when the bad ones come. But today I've only had one focal and I was aware the whole time, and that's a first. That's absolutely a first. I knew what was happening. The trembling was there, the twitching was there, but I could see it. And at this point, I remember it. I couldn't get words out, but I, made it to where I had to go and just got out of the heat. I think it was the heat that brought it on. I got to drink a ridiculous amount of water when we spend time outside. It's annoying.
May I ask, was it easy getting off the benzo? Because I've heard it's extremely difficult coming down off those. Like
Honestly, there's so
withdrawal
many
and
other
stuff.
stressors right now. I would blame anything that went wrong on, the divorce of the toddler. So
Okay.
yeah, I think
Don't
the
blame the
the
toddler.
benzo pales in comparison.
Yeah. All right. All
But
right. Thanks.
yeah, you can definitely do it. And I would say gradually is important. So like when I was taking the 20 twice a day, it's the pills are whatever they call that when it's got the line in the middle, and I just
Yeah.
made sure to mark that date on the calendar of 10 in the morning, 20 at night, then 5 in the morning. And when I noticed I was definitely having more earlier in the day, that's when I just, took it away from the PM dose instead of the AM dose and just went week to week.
All right.
But I'm excited for no bad ones. That's a first.
Yeah,
That's definitely a first.
that's one battle I'm looking for. Well, looking to is getting off my benzo, but right now I gotta go up on the Excopri and get off the Vimpat at the same time, basically. So my head's got a lot of adjusting to do between that before the battle with the benzo.
I got something here.
Oh, 2 new members.
It says, well, let's get some introductions before we start. Christian, and I think
Hi.
the other guy said his name was Amit. Hi, Christian.
Hi.
We usually start with a camera would help, but it's not necessary if you don't want to.
Um,
We
yeah,
usually start with. Oh, go ahead.
how do I do the camera? Oh, can you see me now?
Uh,
I see a video icon. If you're on a desktop, I see the video icon on the bottom left of the screen. Oh, there you are.
there you go.
Yes, you made it. Oh, so proud of you. Thank you for coming.
And the other guy, his name Amit or Amat. I couldn't remember what he wrote.
I see AMIT of it in the chat.
Oh,
Oh yeah,
well,
Curry Lord right there. Yeah, he said so.
Yo,
we'll
can you
start with.
guys hear me?
Yeah, I can
Yeah,
hear
now we
you.
can hear you.
Oh, hi. Well, yeah, my name is Amit. Just a little bit about me. I had my last seizure in May, and I'm on Vimpat, Keppra, and gabapentin. So that's a little bit about me.
When were you diagnosed?
I was diagnosed back in August of last year.
Oh, okay. Yeah, we usually start with what are you taking? When was your last seizure, and when were you diagnosed? Christian, what about you? Or Kristen? I'm sorry.
I'm Kristen, and I'm currently in the EMU right now, if you could tell.
Oh yeah, I talked to
Um,
someone yesterday that was in the EMU as well.
I just had my SEEG on Monday, and my last seizure was on 7 days ago. And then I am on they're decreasing Bravax, and I'm currently on only Vimpat, hoping to provoke a small seizure soon so I can get out of here.
Yeah, I like the head jewelry. Anyway,
You're a warrior.
nice cap you
Absolutely.
got
We're
there.
proud of you for joining. Thank you for both of you for coming today.
Right.
Did you come with any questions or topics that you wanted to jump into?
Are you talking to me?
Yeah, both of you, everybody.
Have you guys has anyone gone through phase 2 testing of the EMU at the EMU?
I
Me,
know I
no.
had to, so let me clarify what that was, and I can remember a little better. I had a couple surgeries for the RNS implant, and prior to that, about 10 EMU stays, just for all the clarification of what they needed to approve for the surgery. So phase 2 testing, can you remind me what that entails?
Phase 2 testing, from my understanding, is the EEG, or I'm sorry, the SEEG, and yeah, I think that's what it is.
Okay, yeah, so I did have to have the invasive EEG, and I was blessed not to have any of the side effects or the potential infections and things that they warn you of, but it was definitely not a pleasant stay. It was the beginning of like no more privacy.
Yes, yes, I have zero privacy here. Zero.
That's what
Yeah,
stood out to me too.
yeah. Privacy and independence is gone. It's out the window. It's not coming back. Yeah, so I got something here. It says, can a vibration plate cause trigger seizures? Has anyone had experience with this? I have a history of seizures, and the only new thing I've introduced into my routine recently is a vibration plate. Since Monday, I've been using it daily for about 30 minutes to an hour. It's one of those whole body vibration platforms used for circulation, lymph drainage, etc. Today I had a seizure episode that felt different than usual, and now I'm wondering if the vibration plate could be a potential trigger. I know sensory stimulation or nervous system activation can sometimes play a role, but I haven't seen much about this specific kind of equipment in relation to seizures. Has anyone here had seizures triggered or worsened by a vibration plate or any other unusual symptoms from using one? I'd really appreciate insight or personal experience. Thanks in advance for the advice. Um, I haven't had a vibration plate and I don't know exactly what it is. Uh, yeah, this is one I have no clue what it is, and I don't think I want to give advice for something like that. Absolutely no clue. Um, Anybody
Well,
else?
Mommy Kate has her hand up.
I would say just like anything else, if it's safe for some, it's not safe for others. Take it one step at a time. I mean, the vibration plate, as far as I know, is an exercise machine. It's recommended for those who are not as capable, I guess, of high intensity exercises or can't kind of get out for a run, but it's the way it stimulates your muscles by just keeping balance, staying tense and staying on the plate. But apparently for some with epilepsy, it is not recommended because of the frequency, I'm assuming. I'm not sure. I'm going to read up on it a little bit, but just like everything else, have somebody there. Don't go at it for more than 5-10 minutes for the first couple sessions and see how you feel for maybe hours or days after. Who knows what keeps this thing going? Because whatever it is, it's getting into you.
It could be a trigger for that person, particularly vibrations.
Yeah, that's the other thing. Everybody does kind of have their own triggers.
So vibration plate would be like, is it something you lay on?
From what I see, you stand on it, so it's about as big as a I can't think of it right now, but it's like 2 feet wide, 1 foot deep, like big enough to stand on. And I'm sure there's some kind of control that turns it on, and it moves, and you're supposed to maintain a good posture and work the muscles that are used basically to maintain balance and stand, and it's stimulation for your muscles. So it is good exercise, especially for those who might not be as mobile. What's coming to mind here is all these like long COVID sufferers who don't have the respiratory capacity to just go out for a walk anymore, and maybe an indoor treadmill is too big. So maybe the vibration plate would be the next best thing, or one of those sit in the chair and pedal machine type things. But if there's any risk for seizures, I probably wouldn't go for this. I mean, then again, too, if you're having uncontrolled seizures, a vibration plate is something where you're standing. So that could be asking for more issues too if you have a surprise one, unexpected.
Yeah.
If for people who don't have auras, because that's something I've never had.
Yeah, I don't have auras either. Just when it happens, it's too late.
Yeah, I think people with I've been looking up, and I think people who tend to have absent seizures and stuff like that tend not to get their auras. So
Okay, I got something else here. It says, just been diagnosed. Hi, I'm mainly looking for advice as my doctor has been slightly unhelpful and dismissive about what I can or cannot do. I'm 21 years old and just been diagnosed with genetic epilepsy, and I'm being prescribed lamotrigine to start with. Now I'm 21 and I'm fairly big party guy. I drink a lot with my mates, and I'm being told that I'm basically never allowed to go clubbing or drinking in excess again by my doctor. But I wanted to maybe hear people's stories or get some sort of advice on how to deal with it in this moment and how to deal with it moving forward. I'm starting university in September and want to get some clarification on what to do and what not to do, not just in the sense of drinking, but in lifestyle, hobbies, and mental struggle of it all. Thanks for whoever responds. The drinking part, I'm going to highly suggest not drinking. I stopped drinking just on Easter, but figured I got to be an example for the people I'm talking to. I don't suggest drinking with these medications at all.
yeah, drinking lowers the thresholds for seizures, so more seizures will come through probably for that. The clubbing, it matters. You can probably still club, but if you're photosensitive, then I suggest not to, definitely. But it's all sensitivity, and you have to be aware. Like, you can still live a life. I have gone parties and stuff and still been able to, do things that doctors advise against. But, my friends were always aware of me. So,
At this point, I think it's going to be, in so many words, grow up, adapt. This is something you have to live with now, and yeah, you need to make changes.
Anyone else? Advice for this kid? He's 21. What do you tell a kid that wants to drink but can't drink?
Sorry, kid, you can use yeah, it's like you can choose your path to death in this situation. That's as harsh as it sounds. Yeah. When the doctor said no, don't drink, why didn't the doctor explain why? I think that's important because I didn't take it seriously, and I was on my way to a higher a nursing degree, and I had no idea. But I think when we're younger, it's even harder, because that social pressure is, that age is tough. It's like, oh, I want to drink. I'm that age. I should be okay. But you have to take the epilepsy seriously, or it'll take you more seriously. So, and that's just, you can't make them listen, but yeah, just don't do it. You don't want to find out how bad it is.
Rick, you got something?
Yeah, I was just going to say, there's a lot of things you can do without alcohol. There's a lot of things such as going to concerts if you can go to the club and dance a bit or hang out. Go watch movies, go to bonfires, go hiking, go camping. There's a whole bunch of things that you can do that doesn't involve alcohol. And there's things you can do that don't involve other things that could be triggers. Like if, flashing lights is one of the triggers, then okay, certain movies you can't see. There's a lot of things that you can do with your friends and, still have an active lifestyle that don't involve lowering your threshold to have a seizure.
On to the next one. Since epilepsy returned to work, I have reflex epilepsy and multimodal or multimodal triggers, meaning I have myoclonic tonic focal seizures from light, sound, movement, even thinking. So it's very hard to avoid, especially in a workplace. I can have anywhere between 1 to 100 plus daily, and they can be violent. I had been off work for 2 months and now have to come back on a graded return for 4 hours per day. I used to be a full shift, full time person. It's been 4 weeks of that already, and I don't foresee the hours increasing for some time as I am still seizing. I am working remote. Work doesn't see the extreme end of it. They don't know I work from a dark room with sunglasses and earplugs in to prevent fits. I just look normal. They seem to be ignoring my return to work plan from the neurologist and trying to fit as much work as possible in the short hours I have, which makes my graded return to work redundant. In fact, worse as there's less time to do my normal work. I want to push back, but it's hard because it's a fine line between feeling like I'm not doing enough, but also not doing well enough to meet their expectations of what I can do. My role also requires in person speeches, education, which isn't something I can do right now. I can't tell them that I'm still fitting as they already made a big WHS deal over it. I don't want to lose my job. Is anybody else going through this or have any advice with this struggle? Personally, I haven't got fired or nothing like that or been through that situation. I think all my seizures just got too worse to my family was like, you got to quit. So I haven't been fired because of it. Just been let go or put on leave. Well, put on leave mostly, not let go.
Yeah, I went through back and forth on medical leave until I ran out of FMLA time. Then they had to let me go. But it's just trying to get your seizures under control is the most important thing. And if you need your sick time and your medical time, I think that's more important right now. Yeah.
Lucy.
Okay, so this one was about somebody being diagnosed and then losing their job.
No, he says that I got to go back through it because you know how that memory goes. Basically, he's not able to do the full workload that he was doing with the half a shift that they put him on now. So he's like, how do I push back, basically, and without getting fired?
Oh, that
Yeah,
definitely sounds like an HR route. I mean, that's the purpose of a union. If you're in that kind of environment where you have like a
Yeah.
representative of sorts or somebody to assist you in, wording this right and sending it to the right person. Talk to somebody else in the company who's there, whose purpose is there to help you. And if not, just, approach it with some common sense. Know what you're going to say when you go there, why you can still do this job, why you still deserve to be paid what you're expecting for doing the job, and I don't know. I always used to think when talking to the employers to have a plan B if they have an answer ready, kind of know what you want to say back.
Yeah,
Yeah,
the
definitely
farmer.
be your own advocate there.
Say that again.
I'm sorry. Yeah, definitely be your own advocate there, and also, have a good document ready that shows this is what I'm able to do. You're setting expectations on both sides. What do they expect of you to be able to still do? What you can bring to the table, and that way you hopefully you come to a good meeting point, and then that should take away a lot of stress about, oh no, they're going to let me go, or oh, they're going to expect so much of me. But if you set the expectations with them, you should be able to work it out. That's what I've done in my last 2 jobs.
Yeah, I think it would work out well, like if you've been there for a while and you talk to them, and that's what it sounds like. Ask them, like, get your doctor to say certain accommodations you need. I don't suggest leaving like I did, because, well, I would say mines are bad, but he did say he's having 100+ a day, and some of them are violent. Um, so yeah, that sucks. I couldn't imagine 100 a day, even if they're just vocals.
That sounds like some inpatient stuff.
Yeah. Um, the next one says, how epilepsy ruined my life at a young age. During a game of basketball when I was in high school in 2016, out of nowhere, I had my first seizure my senior year in high school. I'm sorry, you guys. I thought I seen something. During a game of basketball when I was in high school during 2016, out of nowhere, I had my first seizure. I had my entire life planned ahead of me. I was taking college credits for aircraft mechanics at 17, only needed to take a year to graduate. I had a full ride scholarship, so everything was paid for. I loved doing the work, but my seizures got unbearable at one point, and I was having 7 seizures a day and couldn't take it anymore. One day, I had a seizure, and with the power saw in my hand, and I sadly had to drop out of school with 6 months left to graduate. I would have graduated school making 75K in the South, which is extremely good money, and then 100K after 3 years with no debt. My seizures were so bad that I spent 3 years in and out of the hospital while living at home, doing nothing, and had over 300 seizures during that time. At one point, my vision was blurry. I was losing my hair, and then at one point, I couldn't even stand up. Finally, around 2022, realizing all the medicine was not working, when I went to another doctor and found out I had a brain tumor. I finally got brain surgery while my vision got worse afterwards, and I went to pursue my bachelor degree. But then I kept having seizures. They eventually stopped, but I just hate how I had my life prepared at such a young age. I stayed out of trouble and was a very religious person, but it all backfired. And now I graduate college in a year expecting to make half of what I would have made if I was able to stay, and will now be in debt for the rest of my life. Sometimes I can't even go to sleep at night thinking of how good I would have had it. And out of all people, why me? I would have had 100K, and now graduating college, I'm only expecting around 50 to 60K in debt, and in debt forever. I am now 24, but I had a life plan at 17, but sadly, epilepsy ruined my entire life. I'm still not able to drive. Some of my hair never came back, and I had to get a stronger eye prescription due to the surgery. I'm still recovering from health issues and depression from those moments, and still not able to live full life. If you're listening to this, it gets better. It takes time, but it gets better with time. I've been dealing with this for 20 years, and I've been through that mad depression to where angry at the world and angry at everybody that it happened to me. Why me? Like you said, it gets better with time. You just gotta. It takes time, and I would just say not just go about your life, but yeah, don't let it get to you, which is hard to say. Try to live your life. Don't let it hold you back from certain things.
So really try to
Hi,
keep a
yeah,
clear head about it too. Go ahead, Angel.
I was just gonna say, yeah, I was diagnosed young too. I actually wanted to be a pilot, but yeah, there's nobody going to be a pilot with having seizures. But yeah, it does get better with time. You know, you're going to be there. There's like a little process you got to go through, and that first is the denial and everything, and then you come to terms with it and you accept it. But I always feel like that when we're young, we just adapt to the lifestyle that we have to live now. There's still things we can do, you know. It's just not what we wanted to do.
Yeah. The things we didn't want to do. Yeah, that's very spot on. I keep. I think we are talking about something about a shame spiral the other week. We always go back, and it's very very common to you always go back in your head and think what would have been, but that's and you say, well, just don't do that. It's so easy to just say that, but when you think, I well, and but all the compromises like you made through your life and all the compromises you made for your health and what would have been, but it's difficult to throw that away. I know, but here we are now, and uh, I can't reconcile that those two points. It's a rock and a hard place, that shame spiral and telling people to throw it away. I have to I have to acknowledge that that anger and that guilt. It's comes with the territory. Um, but yeah, just do what you can to move on. I don't know. That's even I didn't believe that, but okay.
Yeah, in that first 5 years
No,
was
but
the
I mean,
worst.
even not feeling genuine, it is what you have to do. I mean, having to reprioritize your life at the most inopportune times is something we've all had to do. But that's why, I mean, in their example and anybody else who's just getting diagnosed at like the worst time in their life, that's why a group like this and having others seeing people who have been successful with epilepsy would have been so much more useful back then to see that I have a chance of still not only starting your life, but actually doing something with your life, even with this condition. You just gotta get it under control. That makes it sound way too simple, but sometimes it takes somebody just telling you to take a look at your priorities, see what's important, and you can get over this. You can handle this. It can still be worse. I don't know how else to say it. Like you said, rock in a hard place.
Yeah, don't let your disability hold you back from anything. I mean, some things you have to, obviously, but I don't want to say, don't let it, would the word be hinder you? Don't let it like hold you back. If there's things you want to do, there's plenty other things you can do. You got to find hobbies with this epilepsy stuff because it can take everything from you if you allow it to. And yeah, mine was the worst in the first 5 years, and then I eventually just got over it. But yeah, the denial and the hate for yourself and angry at the world, that's how my first 5 years was.
But if I may add, it did get better. My health did get better. So I have to add that. I mean, so yeah, I know I said all that negative stuff, but my health did get better. So
Hey,
I
Important
Em,
got
point to make.
the question was someone said epilepsy ruined their life. He said he had a lot going. He wanted to be, I think, a mechanic or something like that. But he was 17 and he was like, I was going to make this amount of money and get out of debt, I guess. And now he's 23 and he's not doing what he wanted to do. What do you say to that person who got it at 17 and now they're 23 and I'd say kind of depressed?
Yeah, that sucks. And I'm sorry to hear they got diagnosed at 17. That's so unfair. Do you know what kind of epilepsy they have?
Um, I think the person did say, I can't remember, but it's a lot to read and go back through. But
All right, I'll just assume they just have epilepsy. And to watch out for myoclonic jerks. They said they couldn't be a mechanic, so I'll just assume that's in there, some kind of thing that physically not able. I mean, check out different trades that maybe are similar, but or even like something adjacent to mechanics. I'm sure they're out there. Even like working front desk there. You know, I'm sure there are jobs related to it. And then doing that will probably open you up to other jobs you don't know about. But to address the depression, yeah, epilepsy ruined my life too. Before I got diagnosed, I had to stop running. I was in light manufacturing and I really loved it. But every time I looked at an LED, I threw up. So I feel you. I feel like sometimes people just need to get their anger out, and that's fair. And if they can ask their parents to send them to a therapist, one they actually like, that would be good too.
wish I had a therapist back then. Anyhow, anybody ever took lamotrigine, Lamictal?
I took Lamictal before. I'm trying to remember the side effects.
Hair
It,
loss.
it's a good. It's not as bad as some of the other ones. It's a good mood stabilizer, but it can make you tired and um I remember everything, like all the side effects
A
that
lot
I
of bad
faced.
ones. Yeah, I faced a lot of the worst bad ones. And like you said, it does make you drowsy. I just took it a little while ago, but you guys doing this keeps me awake, keeps me going, including breakfast that I haven't touched, and it's past noon. But anyhow, it says lamotrigine insomnia. I take lamotrigine 100 milligrams in the AM and 100 milligrams in the PM. How the fuck is it that I'm so fucking sleepy and dumb all day, but as soon as I try to sleep, I'm completely wide awake and I just can't fall asleep. I'm so frustrated. I just want to be asleep. I have work in the morning. FML. Oh, fuck my life. I've been taking this for over a year, but in the past 3 or so weeks, I just cannot sleep at all. I feel like crying. What do I do? I take Lamictal and I take 200 milligrams a day, twice a day. It does cause insomnia because I have it now and I can't sleep. It's so hard for me to go to sleep. For some reason, it's so much easier for me to nap in the daytime so much. And at nighttime, it's so hard to
Yeah,
fall asleep. And like, I thought my triggers would be like sleep. Come to find out, my triggers aren't sleep. I can stay up playing video games till 6 and 7 in the morning, and I'm wondering why I'm still not tired. And eventually, I get tired once I take my pills, and I'm like, oh, I've been up 24 hours now. I'm trying to take a nap. So yeah, lamotrigine, it does cause insomnia. You got to look at these pills before you start taking them, and that's what I didn't do. I didn't look at side effects. I thought, okay, this is gonna work for me. It'll slow down my seizures, which it did. But side effects, doctors aren't gonna tell us. Like I said, most of those doctors, they're on a don't ask, don't tell. So you got to ask and do your own research because they're not going to be our advocate.
Yeah, same with some pharmacies too. They won't tell you everything, but if you got a good pharmacist, um, ask them, and they should tell you everything. You know, consult with them. Um, but most of the time, it's like what you said. You got to be your own advocate and do the research yourself.
That's one thing I wish I would have learned at a young age, about, help with the prescriptions and the pills, the side effects and everything. Because you only see a doctor like once a year and for like 15 minutes. You're in and out. And I think you deserve I know they're busy, but we deserve a little more information about, what this is going to do to us. And,
Yeah, if I could have
that's
told
it.
my younger self something, I would have basically said, "Don't be so ashamed of wanting a second opinion." I don't know why that it felt like there was some stigma around that. Once your doctor tells you something, like you're betraying them if you don't like what you hear, so you want a second opinion. Somebody else look at these scans and tests and try and tell me I really do just need to keep adding on more medications up in the dose and then keeping on this like revolving door kind of cycle. Yeah, I definitely would have told my younger self to talk to other doctors a lot sooner.
Yeah, I think the younger self, depending on the age, like for me, between 14 and 18, I guess I didn't have no say. You know, the parents had the control of what I was taking. And then after that, it's like, I got out of school. I don't want to do no more research. But yeah, I wish I did too. You know, it's like, you really do gotta look at it. You gotta look at everything it interacts with and what you shouldn't take with it either. Because it could even be foods that set it off, such as grapefruit or chamomile.
That's a really good point. I think grapefruit even like diminishes the levels of it in your body.
Hey, Jeff.
Hey, Poke, how are you?
I'm all right.
How is everyone?
I'm good. You
Hi,
didn't have a
Jeff.
problem logging in, did you?
No, I was at the doctor getting an epidural in my
Oh,
back,
no.
and then I'm on the way back home, taking the chance that my wife won't throw me out of the car. An epidural is it's kind of a numbing shot in your back.
Yeah, I know. I had a few of those. I mean, I watched a few
Yeah,
of those happen. Yeah, it's rough.
yeah. I've had several, and I'll probably go back in a couple of weeks for an AC joint injection.
So does
What's
this
that?
one kick in for you pretty quick? Feeling better yet?
It doesn't really. I feel better from the numbing agent that they put in. It doesn't really kick in for about 2 weeks, and then I hope it gives me some relief as long as I'm here.
There you go.
And I'm on the way home, and then I'll just black out the camera for a while I eat lunch, and then I'll be listening, but I'll be blacking you out.
You
Okay.
enjoy
You don't
it.
want to see me eating a hoagie.
Jeff, next time you get in the car, just get a helmet in case your wife really decides it's time.
She said she wouldn't throw me out.
Yeah. Yeah, we're on to her. Yeah, she knows. I know. We don't want her to have to do that though either. So behave.
And she's not going to mess with you. That's for sure.
Oh, I think we would get along really well. Something she's been putting up with you, bro. I have a feeling I would get along quite well with that woman.
Yay, Annie! Yay, Annie! This is the wife talking here. How are you?
Yeah, I'm good. I can tell. Yep. We would probably be friends because yeah, I love how you do it.
That's Liz.
Hi, Liz.
Hi, Annie.
Hi, Liz.
Hi, everybody.
Hello.
Hey,
I feel
hey.
privileged to be on your chat with you for a few minutes. Jeff was concerned that, I would not want to do this. And I said, no, I would like to do this because I would like to hear and learn the same way you've heard and learned all this time that you've been on the chat. So please don't let me interrupt any longer, and you all proceed with your conversation.
And Liz talks a lot more than I do, in case you couldn't tell.
Oh, I'm
Oh,
sure.
we're very interested in having her anytime.
And ask any questions you have, Liz. We can learn a lot from caregivers as well as fellow people with epilepsy. So yeah, seeing it from your point of view is really helpful for all of us. So
Everybody's perspective counts.
yes.
Thank you.
She's been my caregiver for 24 years now. Even more than 24 years.
39.
Before I got epilepsy.
Well, you only have epilepsy for 3 years.
Right. So she's been taking care of me since I met her.
Lucky you.
That's love.
I am lucky, and it is. It is
There you
love.
go. Beautiful. So is anybody else suspicious of clinical trials? I saw another post, and it says I qualify. Once again, we'll call you on Monday, and that I don't know if I should ever accept, treatment for payment. Is anybody else ever done one of those?
I have a question too about this, Kate. If anyone knows, it seems like after you get accepted, a lot of them turn out to be like for dangerousy medications.
I plan on asking them, then doing my own research and deciding at that point. A lot of times, I think if it is something like that, I'm probably just going to get turned down because of the breastfeeding. I don't know at this point if it is even for a medication or if it's for a procedure, but I see paid clinical trial and, just want to hear them out at least.
Yeah, I'm interested in the non-invasive kind, and even that kind of scares me, but I'll definitely be talking more about that as I find out. But yeah, I have to agree with M. Usually when it's a paid clinical trial, those forms that you sign to get that payment include legal jargon, so you cannot sue them if any harm comes to you. Anytime, and tell me I'm wrong, but if ever you do any clinical trial, especially if it's a drug procedure, anything, read every word, have somebody else read it for you, see if you come up with the same concerns, etc. Because I won't take a drug or do a surgical procedure that hasn't been tested. But even then, we don't know. But yeah, usually those paid trials, there's a potential for harm. Yeah, I remember, and I was thinking about this, and just throwing this out here, tell me to shut up. But going through this consideration for another medication, I couldn't remember who, what, when, and where, and I don't have all of my records. And I've been in contact with a few of my previous doctors. And my favorite here near Buffalo said, I remember talking to you about a clinical trial that you were presented in, I think it was like 2015, 2014. And it turned out that it was for Xcopri. And I turned it down. He said, it's not a bad thing. This can't hurt you. And I'm like, oh, you're kidding. So it's like, okay, maybe this will work because it's more targeted. But yeah, Xcopri was one, obviously, any of them, Vimpat had to be tested. All of our medications have been tested, hopefully. But yeah, I mean, maybe let's say I'm older and I'm knocking on the door. I will be like, okay, I'll try it. I'll try it for the sake of my fellow warriors, but right now I don't want to take a chance like that. But yeah, if they're offering you money, there could be something there you want to know about before you sign.
Okay. I'll definitely keep that in mind.
Oh, I have this one in particular. It says marriage. Anyone just struggling maintaining a marriage. I don't remember last week, so the fact that we argued about whatever 3 weeks ago just literally doesn't exist for me. I'm sorry that this happened. I truly am, but I'm not ever going to be the thing they want me to be. It's like 5'9" and they want me to be 6'5". I don't know what to do. I need help here. Everything is going to fall apart. Help with marriage and seizures. I had never been married, but relationships, none of my relationships have been ruined by epilepsy, but I'm a child. I mean, some people. Not a child. I'm young and still going through my prime. So, marriage, anybody? Anybody have problems at home? Has your medication ruined your marriage or?
I have input, but I kind of want to hear from people who are married currently.
Technically, I'm still in
Or
that
going
boat.
through a divorce. Going through a
Yeah.
divorce too.
Technically, I'm still married. 15 years, so pretty much all of my prime with him. Epilepsy, maybe I used as a little bit of a crutch, saying I definitely don't make enough on this SSDI. I was definitely too proud to ask for help until I really needed it to just be able to get out of that situation and actually, keep my children in the quality of life they deserve. But that's the only thing I could really associate epilepsy with the downfall of that relationship is I used it as too much of a crutch. I saw it as too big of a reason to need him, and that's just not true.
Yeah, that's so not true. And like not just epilepsy, but like I got divorced. And you just don't plan for that when you're dealing with so much other stuff. Like if you're in an abusive relationship, like there's no bandwidth to plan for it.
Now talk about waking up one day and thinking 10 years ago I didn't think I would be here.
Oh man, I've said that a few times.
Yeah. This person posted a rant a couple days ago after I guess they saw a neurosurgeon. So it says, I subscribe to the belief that these people are smarter than me and know what they're doing, but nonetheless, I feel anxious. I had a seizure caused by a stroke due to blood in my brain. It's called a cavernous hemangioma, I believe. This seizure has caused me to, yeah, they probably just spelled that wrong. Anyway, seizure caused me to be on a breathing tube for 30 hours in the neuro ICU. I feel lucky to be alive. The neurosurgeon at the hospital said I do not need surgery. When I saw my neurologist, she suggested I get a second opinion. I went to Northwestern, they're in Illinois, and that surgeon also said I don't need surgery, but there's a 9% chance I'll have another seizure in the first year and 3% chance for the rest of my life. I'll be on Keppra for the rest of my life as well. I understand brain surgery is a big deal. Obviously, I don't want them cutting my skull open if unnecessary, but I feel so anxious about having another seizure. Is it possible for me to have another seizure, but it not be as severe? Should I work on reframing this and just be more grateful that the two neurosurgeons said this? And is it better to err on the side of caution and assume I will have a seizure again? I just feel so worried about the 9%. Frankly, I don't care about taking meds forever, but I'm scared of having another seizure. So this person just wants to know basically what to do. This is that first fork in the road, essentially.
Oh, I wanted to kind of suggest too that if no one has specific knowledge of this, we pin this and ask it again once like Tom and who was it? Someone recently had brain surgery. She was on last time.
I know
Rachel
you're talking about.
was Rachel. Yeah, I think that's Rachel.
Yeah.
Rachel and Reese.
Yeah, Rachel. We have a lot of Rachel, Reese, and now we've got
Yeah, Kate, can you mark that to come back to? I think that's a really good question.
I got one here. How to rest. How to rest without guilt. I hate taking off work because I love my job and my coworkers, but sometimes I am absolutely useless and I need to rest, but I always feel so bad. My coworkers appear to be very understanding, and they're also not American and are always telling me to make sure I rest, but I feel like I'm being annoyed by needing to rest so much. I'm also the type of person who works multiple jobs on top of 18 college credits per semester. But since having seizures, I've been unable to do that as well. I think post seizure, my brain is like slime mold, if that makes sense. It's not thinking, and I'm sleepy, but I get antsy and need to get at least puts around, but then I'm exhausted. Still, I don't know. So how do I get over this? Will I ever get over this feeling? And then there's the long the guilt part. Someone help me with that.
Okay, I will. Oh no, Angel will. Just kidding.
It's really hard, but you really can't blame yourself because you didn't choose this. Um, you didn't choose to have a seizure. You didn't choose epilepsy. Um, you know, it was chosen for us by some unknown reason, or sometimes the reasons are known, but uh and you can't blame yourself for that. And you need to rest because I'm not saying to over rest, but you need to not push yourself too hard because stress is a factor which can lower your threshold for seizures. And that's why, if you take on too much, you're going to go through a big one.
Yeah, and look at it this way, like, because God, Angel, that's so true. Like, you're having guilt now, but what you need to look at is the long term. Take care of yourself first. Get as much sleep as you need to right now. Get yourself figured out because you'll have more guilt later if you have to, if you're just in this state of constantly trying to catch up with yourself. Yeah, and you mentioned get therapy. Yes, and get a therapist that you like too. Like if you don't like them, just drop them. One I forgot the rest of it.
Me too. I got something here. It says need advice. 3 days ago, I ended up drinking only 2 drinks, vodka and Sprite, but a small amount of vodka, nothing major. Only reason why I drank was because it was our country's major celebration, and I guess I just wanted to feel normal without a whole "you have me, you have epilepsy, can't ever drink" vibe. The day after, had the day after, my head had a lot of pressure only on the left side, on the left front side. A really bad thumping sensation every time I moved, but it kept coming and going. I thought it was normal hangover, but one, I never get a hangover, especially after only 2 drinks. Two, it's now continued onto another day. It's continued onto day 3. I'm in pain with my head, I really dizzy, and just not myself. I'm on Vimpat, 200 milligrams. I have focal epilepsy and also have an arachnoid cyst on the left posterior fossa, 16 times 34 millimeters. I'm worried that maybe I fuck something up. I have drank before maybe on my meds and more than 2 drinks, and this has never happened before. Is this a cause of concern? Should I get it checked out? It's nothing to get checked out. This is something you can handle yourself. If you got a cyst and you got other problems going on with epilepsy, I don't suggest drinking, not even 1 drink, not a splash or anything. I stopped drinking on Easter, so I'm not one to talk much, but I stopped cold turkey, so I'm not saying it's easy for everyone, but yeah, just not drinking. And the medication is not a good thing to drink with, so.
Hey, Pookie.
Yes.
Yeah, that arachnoid cyst thing. Yeah, with or without epilepsy, absolutely 0 Z, no tolerance for alcohol. Yeah, and I wasn't holding on to where it is or what types of seizures this individual is having, but even without an epilepsy diagnosis, an arachnoid cyst can really change things, and you don't want to give it something to do that with. Don't fuel the fire.
Yes, I totally agree with this. Oh my God. And I wonder how old this person is because I strongly suspect I had a stroke in my 20s. And my MRI, it's possible. I mean, I just tried to put an earring in and poked it into my cheek, and I can't tell how deep because I can't really feel that side of my body. And I'm looking so young, but I am not. And man, you don't want to go into your 30s, 40s, 50s, whatever, with not being able to feel certain parts of your body. If you like having sex, I don't recommend that.
Yeah, alcohol just seems like a fuel to the fire thing for all of these conditions mentioned, since it's a blood thinner. I mean, who knows what effect it would even have to just make everything worse. So handle one
Yes.
thing at a time and definitely don't make partying a priority. It can't be. You can't.
Amen. Listen to Kate. For fuck's sake, everybody listen to Kate.
Right.
I
Because
was drinking when it happened, by the way. I forgot about that. I was drinking. I had 1 sip of alcohol and my head went down.
oh God, yeah, and this, it's like I appreciate that these people come to Reddit for these questions and the support. But why aren't they taking it seriously? Like if the doctor came right out and said, "Okay, you have a malformation in your brain and alcohol could make it exponentially worse and kill you." Now, if we looked at epilepsy the same way as we looked at that malformation, maybe we could take this more seriously. But even people, yeah, with our new diagnosis, I literally ran away from it. I'm like, no, there is absolutely no way. No way, no way. And I went on for, I would say, about 6 months driving like nothing happened and thinking, oh, I'm fine, I'm taking this medication, I'm fine. Yeah, no, I went through that denial, but it's like they really, really need to understand how important it is when the doctor says no alcohol. And some doctors aren't even doing that, but with an arachnoid or like a cavernous malformation, any malformation or tumor in your brain, I thought maybe most people would know immediately I really shouldn't be using alcohol. You know, I don't know. Am I being, yeah, I don't want to be that person, but it's like, come on, really? You need
Yeah.
somebody to do that you got something wrong with your brain, but you can still go and party? I don't know where you're at. Yeah.
Not sure if anyone has sister advice for this.
Yep. Oh man. I agree with Kate. Kate, I agree 100%. There are people in there fishing, which is why I get a short fuse on stuff like this. It's like if you just want us to tell you it's okay because your doctor said that you can't, go away. Because I just might come along and Delta's right alongside. You don't need the alcohol, but yeah, fishing for approval. Like the doctor said, no, you can't have this. Oh, I'm going to go to epilepsy support groups and ask them and do what they say instead, because that's what I want to hear rather than listening to what my doctor said, because all these people living with epilepsy are saying, no, it's all right. Yeah, no, it's not. And I do see a lot of that going on, not in our group, but some of the other Reddit groups. People are just like, yeah, sure, it's okay. I did it. I was fine. Blah 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 blah. Yeah, I don't know your individual seizure syndrome. I don't, no. I never, I don't care. No alcohol.
Jeff, you got something?
I used to drink,
Hard to stop.
I wasn't an alcoholic, but I used to drink quite a bit. I enjoyed uh, alcohol. I collected and drank wine for quite a few years. And then one day after surgery, my cardiologist said to me, don't ever drink again. And I stopped. And
Okay.
I think if your doctor tells you not to drink, you have to be pretty stupid to drink, and especially to go on a, a Reddit site and ask the people there. Because some idiot's going to say, yeah, go ahead, have a drink. It won't
I
hurt
was
you.
thinking that somebody's gonna say, "Go ahead, find a drink. You can drink
Right.
this. Tell them what they can drink or how much or stuff to keep safe." Yeah, people are people. So,
I have NASH, which is fatty liver disease. Alcohol, well, NASH stands for non-alcoholic steatohepatitis, but alcohol affects the liver. You think I'm gonna go drink? Hell no.
Right. I stopped drinking because I don't like it anymore. And I have theories on that. I think it's the benzos make you not like alcohol or something. That I don't know if that's a fact or something, but yeah, I mean, I used to drink a lot. I think I mentioned that, but no, I wasn't like an alcoholic or anything. But yeah, but my doctor said, sure, you can drink, but not a lot. And I don't appreciate that ambiguity. I think they should just say either drink or don't. And maybe you shouldn't put this out there, but yeah, but my doctor really said you can have, like a beer or two every so often. And I didn't know what to take from that.
I put off getting diagnosed for a while. I maybe had a stroke. I maybe can't feel anything below my belt. Maybe. But I also do think, to a certain extent, you got to do what you got to do and face the consequences. Like, that's kind of life. And yeah, also, I don't know where this person is. I responded to somebody in Scotland once, and I think the drinking thing might be huge. So you're just like very alienated. I don't know if there's like an AA adjacent, or like, I don't know how you can find people who are sober. But I think it's good you all said all the bad shit shit your doctor said, because I think some people need to hear from older and I'm including me in that, people, about all the bad shit that happened, because your doctor didn't do it. Like, they're not going to be like, yeah, I drank and then my brain exploded and I can't have sex. Like, they're just not going to say that. Also, I think people know if they're addicts inside of themselves, usually. So if you feel that, don't do it. Like, then in that case, don't do it. Just go to AA and meet people.
Hi, Mark.
Hi, Mark.
Hello, everyone.
Hi, Mark.
Can you see
Every
Poofy over here? My cat.
Yay.
Poofy.
Okay, every time someone joins, I'm like, oh, it's my favorite person. Oh, look, it's my favorite person.
Just love to love everybody. What I got here says, when I read it, I was like, I gotta not read this and read this to you guys, because I thought it was like a your own opinion when I read it. It says, if I'm on my meds and I'm taking the right dose and not missing doses, can I live a normal life without caring about triggers? I'm 23. I got my first seizure on the 9th of June and the second one on the 22nd. And I'm not saying I want to pull full nighters or drink a lot or any overboard stuff, just a normal life without caring much about triggers. Is this possible, or should I still worry about a lot of triggers even when I'm on meds? I'm on meds and I worry about triggers all day, every day. I think about it. What's going to trigger a seizure? What should I not be doing? It just comes with it. I'm not going to say it's common sense, but yeah. I worry about my health, so not everybody else does. So if you're worried about your health, and the person's fairly new to it, so you should not do those things. You should worry about your triggers early in, unless you want to find out the wrong way. Wake up in an ambulance or something.
Or the ER. I don't know my triggers at all, but I still worry about my seizures every day. And I don't have an aura, or I can't tell my aura. You know?
Get a nanny cam. That's not directed at you, Angel. But to this
I know you
person.
gotta promote it.
I don't know what you're talking about. Guys, Topo. Just do it. Topo. Topo TP like.
We all got couple.
And seizures are going to get worse, and eventually you're going to figure out that, nanny cam.
Yeah, got a nanny cam.
Oh, nice.
Yeah, and if you want, like, also, I was like, Annie already knew what kind of seizures she was having, but like, I certainly didn't. And I have childhood absence epilepsy. And I think probably more people than know it do have that type. And they just turn into different types of seizures. And I think like epilepsy, they just turn into different seizures and they just aren't caught, in my uneducated opinion. So yeah, get a nanny cam, or like have people be honest with you if they notice anything weird when you feel weird. So that way you can take them or the videos to your doctor to get on the right meds. And from what you all have let me know, it's not just like I take this med and my life goes back to normal. Unfortunately, your life is not what it's going to be like. It might take a while to even get to the point where most of your seizures are controlled.
This person is 23. You guys got advice for this kid? Just had his first 2 seizures.
Yeah, literally just diagnosed a few weeks ago. Yeah, just don't get too scared and listen to your doctor. If things don't sound right, ask around. And therapy, you're going to have to learn how to accept it. You know, it's a late onset diagnosis. My therapist equated it to a life-threatening car accident. You could be 11 years old in a car accident and become a paraplegic. It's really not that different. You know, your life suddenly changes with a diagnosis of adult onset epilepsy. And I really appreciated her saying that, because I never, you know, it's like, yeah, you know, well, you would take it seriously if it was a heart condition or this or that. But yeah, you would take it more seriously if I was in a wheelchair. But just like us, we didn't expect it. We didn't ask for it. Things just happen, you know, and the same kind of trauma that they, you know, that she uses on people who have had accidents, or, you know, she's with active military. So that's the kind of trauma she deals with. So it's like, yeah, I trust what she's saying, because I guess it would feel the same way. Like if I lost my legs or my arms in an accident, I think I would feel very similar. You know, it's like my life completely changed. What do I do now? You know, so epilepsy did the same thing to me and to many of us. And at 23 years old, that hurts, because you're just heading out to your independent life. And all of a sudden you realize that might not happen at all. But that's the part that, you know, that you need help working on. So that's why therapy isn't just talk therapy. Therapy includes social workers that get you set up with resources that will help you navigate your new path, because it wasn't one that you planned on, but they might have a map that you don't have. So, you know, it's always good to go for therapy and social work to try to find how to figure it out. You know, that's the best advice that I have. And I don't know, on top of that best advice, don't let anybody ridicule you for therapy. Um, because those that, just on my personal level, every single family member except 2 of them so far who kept saying, you need therapy, are face palming themselves now. So the therapy worked. Yeah, it really does help. So don't let anybody ridicule you out of it. It should be a prescription. But yeah, it's just a different path. That's a very drastic turn, but a different path.
Yes. Oh my God. When you said don't let anybody ridicule you, that's so big. Like, I don't think any of us here have been in the military. I know Melissa has. Um, I just have third-hand experience from some Marines, and one was the captain, and someone literally was calling him almost every week saying a member of their group, I don't know the words, killed themselves. Because I mean, if you've seen combat, assuming you're in the US, who fucking knows? Like, you probably have an idea of like the extent to which that affected you. And I would, if this is available, encourage you to get some sort of advocate to go with you. And get like Annie has a therapist that is ex-military, maybe even someone like that.
Sorry, I had to cough. Um, That's exactly what the next one is now.
Pookie, you're
I
in the
was just
upside
gonna
down.
add to the
Yeah, flip
last
yourself
one.
back over.
Yeah, you're upside down, Pookie. Or am I having vertigo?
But he got, but he got something to eat.
How's
Oh, you're
that?
funny, Angel. No, you flipped, bro. There you go, man. But
It's cool. That's good timing.
okay.
I just wanted to add to the last person, you're new. Come join the epilepsy universe. Come be around us. We all have epilepsy. We can share our stories with you and, we can guide you through it. Some of us have been going, living with epilepsy for far longer, and some of us are newly diagnosed too. So you have friends here.
I love that, Angel.
There you go. I
Like
meant
I'm
to
saying,
reach out to
everybody needs an angel.
I'm like into trying to get some not famous visitor, but some kind of influencer, somebody who's managed to achieve success with epilepsy. And I reached out to a couple people. One boy that was like 13 2 years ago did a news story saying, now he's an advocate. His parents helped him start an organization, and I mean, pediatric having uncontrollable seizures in elementary school has got to be hard enough. And this boy actually made some light of it, brought something positive out of it, and that's amazing. So he's a miracle altogether. But getting a hold of anybody like that is going to be difficult. So I'm not holding my breath. And then there was some other like social media influencer person, some Brazilian chick, and has like a fashion line and products at Ulta, and also an epilepsy advocate for the Epilepsy Foundation. So we'll see if anybody gets back to us, but I know Brandon's doing the same thing, and we're all just trying to get somebody with some influence on here that can show you can still have success. Like Lisa to say, you can definitely still be successful with epilepsy.
Mark, you and Kate are going through the same thing with the lightning and electricity. I think Kate said something like that earlier.
Oh yeah.
You guys are
Yeah,
going through it as
I
well.
like it personally. I mean, except for the possibility that the power might go out. I like thunderstorms. It's the rain is starting to pick up real nice here. It's nice and cozy outside.
Nice.
I just feel bad for my dog. She's still real nervous, so
Oh yeah,
in
the
this kind of
cats.
weather, she's curled up in a crate. I mean, she's out of the crate now, so that tells me the storm is over. Because she has that intuition, like long before this one got here, somehow she could tell that the thunder and the rain was going to last a little longer this time. But yeah, up north it's crazy up there now. They're not used to the heat, and now followed by storms. And weren't you just in like the 90s or something yesterday? You guys are all over the place with weather. That's
Yeah,
crazy.
was it the whole weekend? It was like, I think Monday and Tuesday hit the triple digits, and then yeah, rain.
Yeah, I'll be right back, guys. I just got an alert for a tornado watch. And we have isolated thunderstorms. I know enough about weather. I'm going to cover my roses. I will be right back.
Expert botanist. Love
Be
it.
safe out there.
See that? And
Be
she's got
safe,
skills for
Annie.
that too. She lives a full, successful life and knows about gardening. That's incredible. Talk about keeping your priorities straight. Amazing. Go ahead, Pookie. Sorry. What's the next subject?
I was just gonna say you gotta find things that you like to do. Don't let it consume you. It's hard to say. But if you never find things you don't, you'll probably sit in the house and thinking about epilepsy all day and it'll run you crazy. Been there. Yeah. It says replacing vaping. I have a slightly daft question. I vape to control my mood, but realize it's a seizure trigger. I think due to nicotine, as nicotine gum has the same effects. I use it because conventionally depression treatments don't really work for me. Has anyone else been in the same situation and found a suitable replacement that doesn't trigger seizures? Um, Never really did the nicotine vaping. And if you're having seizures, yeah, you just realize that it's making you have a seizure. Personally, I think that's the sign to stop. I'm different. Maybe I'm different with cutting things cold turkey, not like everybody else, but yeah, if it has to do with my health, I'll just kind of get it together.
Okay, I've been a smoker since I was 17 and I briefly switched to vaping. I also worked for a manufacturing company that makes who cares, but it goes to the government to do studies for vaping. They really don't know the effects, and I'll say my seizures ramped up when I was vaping all the time because you can do it all the time. And it's not just your seizures, you got to look out for what they know now. Popcorn lung. Oh my God, it's unregulated. Please stop vaping. Smoke a cigarette. I mean, to get off of them, don't go on Wellbutrin, but get off of nicotine if you can. Just go straight for the Delta, for real. Like, I don't remember how old they said they were. Please stop smoking nicotine and please don't vape.
That was well said. I don't think anybody can add anything better to it. I mean, talk about unregulated, everything we know is already bad about it, but that's like another one of those posts. It sounds like they were looking for reinforcement, other people just to, tell them don't worry about it or go for this brand or go for this, you know, kind or something. That's another one who's got it. They've got to know common sense that it's not worth it.
Yeah, and
But
I'll take
yeah.
over being good mom for the second, and then I'll go back to being bad mom. Because I think you're right. People are looking to hear just keep doing it, but I do think this person is legitimately might be looking for a way to gently exit that. Hopefully, I'll give them the benefit of the doubt, but I do think some people are looking for options. Yeah, that's all I'll say.
Yeah, for sure, for sure.
Lost partner. My husband has epilepsy. However, it's pretty new to him. Some of my family doesn't know about it, and same with friends. The ones that do, it's like a taboo topic. Nobody talks about it. The vibe and MO. So M-O. Anybody know what that means? Moreover, the vibe and whatever that is.
Yeah, it's MO. You got it.
Okay.
It's MO.
It's the vibe and MO of the ones that know is take meds, and he just had days when he doesn't feel well. It's like nobody wants to admit what's going on and treat it as such. Driving license, etc., gone. I have a hard time not dealing with it and sweeping it under the rug. I constantly am worried something will happen to him while driving. We also have a new baby, and I'm scared to leave him alone with the baby sometimes, and especially in the car or in the morning because episodes happen. It's usually in the AM. I'm at a loss. My family, the ones that I know, are confused and want the baby to be safe, as do I. It's an odd thing because everyone treats it like a taboo thing that we don't want to give any attention to or treat it like it's a real issue. I also think it's affecting our day-to-day life. I feel sometimes like a single mom to our newborn, as he had these episodes and days where he doesn't feel good, and I'm alone taking care of the baby day in and day out. He also seems depressed and doesn't really talk to me. Sorry for the rant. Anything you can say would be helpful.
Can you summarize just in abstract again? What were they asking?
Advice on their partner being depressed and their family treating it like a taboo.
Oh, okay, that's right. That's right.
And she's
So
worried about him being with the child alone or driving with the child. She said, especially in the mornings, because the seizures are mostly in the mornings. Anybody got any input on that?
that's just so touchy because if it's somebody you have to trust with your children, you can't always be as straightforward as you want to be. But maybe just pose it as an educated, I don't know, topic. You know, let them know that you know what's going on, you have control over the situation. Lord knows we don't, but let them know exactly what steps you're taking and why you appreciate this care and talk about swallow your pride. But if it comes to these family members being responsible for your children and and if you feel safe, that if you feel that your children are safe with them, that you're not being judged to that extent, then you just got to keep a good relationship and let them come around in their own time because a lot of people do just have these terrible stereotypes about epilepsy that sometimes take a long time to go away. But best of
Can be
luck. Absolute best of luck.
I
this
just
can be a
want to
very
say,
okay. No, go ahead.
I just want to say, I'm a example of a father who pretty much had to do a lot of taking care of my daughter. She had colic and everything. My wife could not deal with her crying or anything. I have epilepsy, and I've done it. I've been through the ringer and back, I should say, with my daughter. And I loved it. I loved it, and I would do it again. And I taught her ABCs, one, two, threes, her name. I taught her. Um, I was potty training her. Don't like someone with epilepsy. Like there is a lot of uh what's the word, Kate? Stereotypes.
Misconceptions.
Yeah, misconceptions. And we can do some of it. I fed her good and everything. So, and I did it for 3.5 years. So I can do it.
Well, props to you for that. Daddy's girl for sure.
They say this person was recently diagnosed.
Yes.
Okay. Well, maybe accepting this is very difficult for the person. And maybe we were talking about therapy earlier. Maybe that might help because it sounds like they're not dealing with it very well. And maybe a third party might help with the depression, help with uh, anything they're not um, any sort of denial this person might have. Um,
Yeah, Kevin, can I chime in? Are you done?
Hmm.
You were probably, I forgot most of the question. I'm sorry. I'm sure this person can understand. You were probably having seizures before and you were probably handling a shit ton. Like, I mean, coming from all the parents who don't even complain about it, because they love their kids, but you were probably dealing with it before. And I hate hearing this. And I don't even have kids, but now you get to go through the process of finding a med, which ultimately might make it easier. and you have more knowledge about what's going on. And I think that in and of itself is like requires therapy because it's so much to handle on top of everything, like Kevin was saying.
Yeah, me with my kids, I didn't start doing this alone time until like 7 years ago, maybe. I didn't really get them alone a lot because, of course, you know why. They've gotten better, but no one knows that. But still, I spend more time with my kids and love it. My daughter, she used a video and made from CapCut, and she said, "I'm the best father ever." I almost cried. Anyhow, next. It says aura, heavy eyes. Today there was thunderstorms and I got auras. The typical feeling of not being able to think clearly came on, and then my eyes felt heavy. My left eye more so than my right. It's like they were physically closing with me, closing without me wanting to close them. It's like falling asleep. It's like falling asleep, although you don't want to sleep. It's like having fake eyelashes on, then a few minutes later, my lip twitched slightly, and then later on, my pinky twitched. My eggs come up normal, so I have been taking supplements to help with my symptoms, and they are way better. I used to lose my speech, but not. I just get to the sudden brain slowness with heavy eyelids along with slight twitching. So yes, I have seen an epileptologist. Can anyone relate?
Yes, I have these kind of seizures on an EEG, and I was extremely lucky. You may never catch them on an EEG. They could be coming from many places. Maybe if Kevin had this, because I think that that's similar. But yeah, the heavy feeling in one eye, especially, and the what I think it's called forced eye closure, and then closing your eyes makes you have a seizure. But the heaviness and the eye closing and all that, that is actually a seizure. It's just it's hard to catch because of the muscle artifacts. Yeah, that's all. I don't know what kind of seizures they're having. I think that those can be many. It also sounds like their seizures are spreading to different parts of the brain.
I think the question was it aura or heavy seizure? Because it says aura, question mark, heavy eyes.
Yeah, that's a seizure.
Okay,
And
yeah.
I think aren't auras many seizures, but that's a full on like maybe eyelid I forget what they call it, but it's a seizure.
Yeah, an aura is a seizure, come to find out. Anybody get that heavy eyelid? Never. I have insomnia, so I don't even get the heavy eyelids. I'm trying to be tired and fall asleep.
I do. Yeah. I get it on my right eye because my epilepsy started on the left side, and my right eye would just close, and I couldn't even try to open it. It would just close, and I had to pay attention without getting stressed out because that's a seizure. And just like Em was saying, they're hard to catch on an EEG, but we did find out that the trigger for that one for me is the peripheral motion, and we got it to trigger during an EEG. And it's like, what the heck, and they were coming in saying, did you feel that? Did you feel that? And it's like, yeah, it's just this thing with my eye. That thing is a seizure. Okay. Oh, okay. Now I know, but they're hard to catch and they almost have to be triggered, and peripheral motion is when there's things going past the side of your face and you catch it in the corner of your eye, and it can start like an eye movement and it'll trigger a seizure. And it showed up still in the left side of my brain, but it was part of the frontal lobe and not the temporal lobe. So I'm like, oh, so yeah, I evolved. I definitely evolved, but that was what that peripheral. I'm not light sensitive, but I do have the other that sunflower syndrome where if I'm looking at light and I do this shit, I could have a seizure. So that's another, but that's not flashing light. It's the movement in front of my eyes that does that, or
Okay.
my eyes. Yeah.
I'm sorry, I'm feeling interrupted. Someone please get other people to chime in. But you are like blowing my mind because in the EMU, I was like, they didn't catch a seizure. They still told me I had epilepsy, but I I was like, oh, I need to be moving around. Like this is not doing it, and I could tell it wasn't doing it. And during my first EEG, thankfully my partner was there, like, restlessly, boringly shaking around. So that's so nuts. And then it showed up in my frontal lobe, which was super confusing. So thank you so much for that. I hope it helps this person, but I'll send you a chat.
Didn't they say in the part of the question that thunderstorms were coming
Yes.
as part of the question? I want I don't know. I've got it. I don't know. For some reason, it had a weird association with the like the those little handheld um lightning detector things for like electrostatic discharge. Um, like you can literally detect with a device when there is lightning in a storm, coming approaching nearby using the electric fields that it produces. And for some reason, it makes me wonder if that could be a trigger for some people if, like, literally the weather is, thunderstorms coming. If these people themselves, if we are human thunderstorm detectors.
Yeah, he said he gets auras when there's thunderstorms. So yeah. Kate, you got something?
I got my buddy here pushing buttons. But yeah, I agree with thank you for everybody's anecdotes on that one because I didn't realize reflex epilepsy was a thing. Learning more every day.
So the next one says, anxiety attack or an aura? Does anyone else experience this feeling as well? Think I was using my DVS to zap during anxiety attacks I thought were auras. Is it best to just zap myself with the DBS just in case? Sending love to my fellow epileptics. Does anybody have advice? And I hope you have a good day. I don't have a DBS. I don't think I know what it is, but I think I heard of it. So it's not the same. I heard of it, but I don't know what it is exactly. Anybody?
Kevin, where are you? I know you don't have a DVS, but
Deep vagal stimulator. Is that what the DVS stands for?
No, it's deep brain. It's kind of like an RNS, but
Yeah, so it's
yeah,
deep brain
like
stimulation.
yeah.
Sorry, I'm fighting this one here.
Yeah.
What was
And I
that?
don't make it on camera. So the rods that they put in here have I think they said 6 electrodes on each rod, and they use it to get to, I don't remember what lobe, what part of my brain, but that's what they said needed to be done to be able to reach all of the uh, plural for focus, foci, I guess.
Mm.
And that's when DBS comes in handy, when they narrow down exactly where your seizures are coming from, determine it's not all over the place, but that area is deep down where electrodes on the surface wouldn't reach it to interrupt, basically. So it's all about the foci, and if that's the right procedure for some, it's still pretty invasive, but I don't think there's a craniotomy involved. Not positive.
Yes, 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 and yes. Just like your rods are in there, that's pretty much what a DBS looks like. It's basically the rods. And it stimulates the insular area of your brain, which is the deepest portion of your brain, like the okay, what is it called? The hippocampus and the amygdala are the insular brain. And that's what deep brain stimulation does. And a lot of seizures, deep brain seizures fly under the radar on EEGs. And that is important for people to know when you're not getting an accurate diagnosis. It's always a good idea to mention that to your doctor and ask, could this be something that isn't showing up on scalp electrodes? You know, just that simple question, because yes, there are seizures that don't. And it's the deep brain seizures and also an unusual phenomenon called a spinal cord seizure, where a seizure can actually start in your spinal cord at the right at the base of the brain. And we suspected that in my case years ago. And now we're talking about that. It's like, oh yeah, well, your spinal cord is kind of getting pinched again. So that could be happening, you know, but yeah, that deep portion of the brain, um, yeah, it's even more mysterious than the rest of it. You know what I mean? So, but yeah, I, I, I can't remember. I think his name was Nate, and I can't remember his name on Reddit, but he had both, he's got both the VNS and the DBS. And he said those two things together completely changed his life, you know, and I'm so happy to hear those things because, you know, it's like maybe that's an option for somebody else that didn't even know about deep brain seizures, you know, and this is why we're here. But yeah, I would always recommend getting that looked at when you have seizures that are a mystery because they don't show up on scalp electrodes.
Kevin, did you have something?
I wanted to ask, because of what showed, like the patterns kind of showing up on my labs, I'm curious about people who, I know you can do the invasive EEG, but I think it's called an MEG. I don't know if anybody's done that and caught like something from deeper in the brain. Curious.
No. Would you forgive me if I said I forgot what you said already?
No, but I will forget.
Yeah, I forgot already. Um, so there was a question that I could never find it again off and on. I could find it again, but it's a really good question. It was in the epilepsy sub. It said, "What motivates you to stay alive?" Let's start from the top. Let's get this answer from everybody. What motivates you to stay alive and take care of yourself and stay alive? For me, I got kids to be here for. So if it wasn't them, then my mother. You know, mothers shouldn't have to see their child die. That's what I've always lived by. Next.
Okay, I want to also ask, this is not the same, but people with pets like Mark, does that influence like your decision to keep trying to get treatment? Because if you're gone, who takes care of like your animal?
Well, I
Yeah.
am living with my parents, so they would be saddled with my two lovely little ladies. I don't know. It's pretty simple in my case, I guess. Just like I would have to take care of their uh big black one-eyed wonder.
What motivates you to stay alive?
For me, my daughter, my family, my friends.
Next. Don't be shy.
Okay, on my nanny cam, I didn't know why my dog was so nervous that night. And would sleep like he had to be like really close to me to the point where like I need another bed for him. But anyway, I watched on my nanny cam is like every time I had a seizure, he would get up and shake around. And he does that when he wants my attention. And then the cat will like bite me when it's happening. And like it's not like having kids, but I think about like my dog has been doing that probably for how long, and it does break my heart. And that motivates me to it motivated me to go to my new neuro, and I really didn't want to. So yeah, like friends and all that, just think of what they see you go through. And just think about someone else like seeing that and how lost they would be and confused if you run out of the get-go to keep going.
Wanted to say hi, Lufa. You just got here, I see. How are you doing?
I'm okay. Hanging in there.
You haven't had any seizures since we last saw each other,
No,
right?
I had a seizure last night.
Sorry to hear that.
Yeah, I had a tonic-clonic seizure last night after moving. Totally overestimated myself, but that's all right. That's all right. Plus, I'm going through all the med changes, so it was just everything. It was just the perfect concoction of seizure, but broke in the new bed. It's one way tonight.
What motivates you to stay alive?
Probably my mom, because she has worked just as hard as I have to get these diagnoses, especially when I was a minor and still as an adult. So definitely my mom, because then I feel like I'm doing her a disservice by just being like, oh, well, we got here, so I'm just gonna go now. So I gotta do it for her. But hello, everybody.
Glad you're here.
Thank you. Thank you.
And Kevin?
My lawnmower is keeping me alive right now. My garden, my plants. Let's face it, the challenge is keeping me alive. Yeah, it just yeah, the challenge that we face literally keeps me alive. And I had forgotten what that was like until recently. Thanks, you guys. But advocating for myself and for others, that's what keeps me alive. And I hope I can get more energy to do more. But yeah, I'll say it's that.
Kevin?
There's something I need to do. And pretty much just one thing. And I don't want to answer. That's pretty much without just. I need to find a woman. That's it.
Gotcha. Mark? Wait, did Mark go already?
Commented about my cats, but I didn't really answer the question. Well, my family, my parents, like I mentioned before, they're supporting me through all of this. my sister, nieces and nephew, but also it's gonna sound corny, but Jesus, um, I'm just convinced that God's not done with me yet. And who knows where this is gonna go, but it'll be interesting. That's guaranteed.
Jeff.
I'm kept alive by my wife. I don't want to leave her. And that's what motivates me to stay alive. And the only thing, I've thought about ending it many times, before I had epilepsy. And I've thought about ending it since I've had epilepsy, but I'm not going to.
Been there.
Yeah.
Been there a few times, but yeah. Amit?
So I would say for me personally, family, mom, dad, sister, they've been through it with me for everything. My sister actually, she has juvenile myoclonic epilepsy, so we kind of, go through it together. And so, I just got to be there for her and, just be there for my family, my friends, everyone in my life. They've supported me, so I definitely don't want to disappoint them, and as well as my future self. So that's what keeps me going personally. So I would say that.
Okay, like most of us, we're the ones having seizures, and some say traumatizing people. You probably seen one. How was that? Because I've never seen a seizure, except for on TV or replay the camera. Is it traumatizing?
Definitely. Yeah, I would say it's traumatizing for sure.
Okay. Good
I,
to hear
I
that from an epileptic.
hmm?
I said, good to hear that from an epileptic.
Yeah.
I'm sorry,
Yeah,
guys.
so it sounds more believable to say the least.
Come on, Ian. You got something?
Yeah, no, I was just gonna say, like, I'm in college right now, and I've had like really bad seizures in college. I remember I was studying in the library one night, and I started having the symptoms like the aura and everything, and it was full on tonic clonic, it was bit my tongue, fell unconscious, and next thing I know I'm in an ambulance, and it was really bad. I spent like 3 hours in the hospital, and then it was pretty traumatizing, honestly, but I guess I got through it. So, and then I had another one in May. It was the same sort of deal, but I was in the dorm by myself, and that was really scary because it was just me. My roommate wasn't there, and I had the aura again, and uh I somehow managed to call my mom and dad. Like I didn't have the strength to like pick up my phone because my right arm was really numb and it was weak. I remember I just didn't have the strength. Somehow I was able to call them, and they called my roommate, and then the officers were in my dorm, and then they called 911, and I was in the hospital. So that was probably the scariest one when I was by myself. So it was, it's rough, but I guess that's just what we have to go through, like as epileptics. And
Yeah.
yeah,
I
so
woke up alone quite a few times, so I understand what you're saying. And those are the scariest, especially when you don't know who you are or where you are.
hmm
Someone asks you, "Who are you? And what's wrong?" and you can't say anything because you're confused. Been there, walking the streets. Um,
hmm
and this one right here. Has anybody ever had a temporal resection? No? If not, we're just going to give this person some advice. It says, those who had a temporal resection, how frequent were your seizures? I had an EMU stay in late January and neuropsych evaluation in April to see what options I have with new epileptologists. I have a follow-up appointment tomorrow and receiving a doctor's note in my health portal that recommends right standard temporal resection. My question is, those who have had similar surgery, how frequent uncontrolled were your seizures? I was good for 3 years until 2021, and then since they have progressed from every few months to once a month and every few weeks. My trigger now is poor sleep, and for the most part, every seizure has been after a bad night. A few haven't, though. After the last seizure last month, I was thinking, fuck my life, I hate this. Let's go get this brain surgery. But now it's real. I'm having doubts about having brain surgery. If it's possible that lifestyle modifications will help, but not that level of surgery. How frequent were the seizures? Any advice since we don't have it? I don't have the advice. Hoping one of you guys do. Did you say something, Kate? No.
We might want to pin this question because I don't know if any. Oh, Kate's trying to test her mic. I don't know if anyone here has had surgery.
Kate and Kevin.
Yeah, but it wasn't a resection. Rachel had a resection though. Well, Kevin, didn't you have a resection? My thing, I'm just throwing this out. They mentioned lifestyle changes. They will not affect epilepsy unless you're doing things you shouldn't be doing, like consuming alcohol and other substances. But yeah, lifestyle changes won't reduce the need for surgery, or you know what I mean? I see that all the time. Just yeah.
Well, I've always been I always I'm a big supporter of routine in uh, I always talk about routine, just you got to have your life in order, your medicine, sleep, everything is very strict lifestyle. It sounds very boring, but I think that really helps with things. It helps reduce, I think it helps with the threshold and uh, helps reduce bad things, and it just helps, you know.
Kate is saying here in the chat, her headset is having problems. But she says, once it gets to surgery, a change in routine won't be enough to negate that need.
Oh, okay. Well,
For that person. And there said, basically, we're asking how were the seizures. Sounds like this person might be bad. But to the next question, it says, hair loss with epilepsy meds. Anyone notice hair thinning or hair loss with epilepsy meds? Does that come with the territory of all epilepsy meds? On Keppra, 1,000 milligrams daily. Feel like my hair may be thinning. I'm 21. Anyone else have any ideas on this? I'm 35 and I still got all mine, so I don't have any advice. I'd say stop Keppra. That's my only advice to everything. Don't take Keppra, but listen to your doctor, not me. I'm not a doctor at all. I've never been to any type of medical anything.
I had hair loss on Lamictal. I'm also on Keppra. It stopped for me, but I was looking up a lot of threads. The bipolar thread has a lot of good information on Lamictal. Yeah, mine stopped, and it seems like it doesn't stop for a lot of people. And you're 21, and hey, stop licking. Stop licking. Sorry. You're 21, and my dog is like going to town on himself. You're 21 and you need your hair. I think so. It's such a big part of your identity. So I would try a different one.
Yeah, talk to your neuro. Come on, you guys gotta have advice for this girl. Anybody hair thinning? No?
Go to a dermatologist,
Mm.
a medical dermatologist. Mine helped me because my hair literally falls out for 3 months after I get an EEG, especially when they use the glue and not the paste. The glue is for 24 hours or more. It literally, my hair just, of course, it gets broken, but it's the rash that I get from the glue. And it got so bad a couple of years ago, I went to see my dermatologist, and he gave me a special shampoo for a couple of weeks and a steroid solution that I put on, and it calms it right down. My hair started coming back. So yeah, I that's the best advice I can give from my experience. The problem is I have to have another EEG. So as soon as it all comes back, I got to go and get that airplane glue on my head again. So, it's like, okay, I'm ready to shave it off. But yeah, that's what worked for me was a dermatologist.
There's another one that says, has anyone done a life overhaul to live seizure free? Have you ever changed everything within your power to stop having seizures? I mean, a full life overhaul: sleep, diet, stress, environment, mindset, therapy, anything. Did it work? What did you do? I've been asking myself what this would look like and thought I would ask anyone here. Anyone have any life changes? No. I don't think I changed. I think I changed a few things, but personally, I think I've learned to manage the things I do. So, yeah. And I'm not seizure free, so that's probably why I haven't had the life overhaul seizure free. Go ahead, Jeff.
Well, I changed where I lived, and it didn't have any effect on the seizures. I don't understand well, if you have epilepsy, you have epilepsy. I don't see what those kind of changes are going to affect.
It says,
Well,
what did you do to live seizure free? Oh, Kevin, you're seizure free, so this is
yeah,
seizure.
I mean, um, this is going back a long time, when things were really bad, but this is not. I don't know how this can help, but uh, removing stress was really helpful when things were awful. You know, I'm not gonna say what I did specifically, um, but yeah, I just took some time off college, and I was a few months seizure free, and that just did wonders. But now when I'm seizure free for 6 years, um, I did do a lot. I was running a lot, but I wasn't seizure free then. I ended up this was one of the last seizures I had. Um, I fell down the steps, and I had to stop running, and I broke my foot. Um, so that was like the last of the exercise I did. But I did exercise. I got my diet in order. Um, routine, like I always said. Yeah, I did make major life changes, and I think it really helped in addition with the VNS. So yes, I think it's all uh, life changes do help, and I think it's yeah.
Hey, Rick, welcome back.
Hey guys, good to be back.
Oh my, bring us back. So you guys are right on time. Rick, I was going to ask you. There was a question we had about temporal resection. Is that what you had?
So when you mean resection, like I guess cut in there and do something, or
Yeah, it says temporal resection. I know you had something done in your head, so I was wondering if that's what you had.
yeah. So my right temporal lobe, that's where I had the brain abscess. They went in there and cut that out and left some nice scar tissue for me. And I also had cerebral spinal fluid leak because I had holes in the bone. So the first time they put a patch, that didn't work. So then the second brain surgery, they lifted my brain up and they made like a 7-layer lasagna or cake. They put a whole bunch of stuff in there to patch it for good. So that's what I had done in there. I have not had a resection, and it looks like Kate wrote in there, resection is taken out a focal for seizures. Okay, I did not have that, but that same general area.
There was a question you just came on the end of it. It says, has anyone done a life overhaul to live seizure free? It says, have you ever changed everything within your power to stop having seizures? I mean, a full life overhaul, sleep, diet, stress, environment, mindset, therapy, anything. Did it work? What'd you do? I've been asking myself this and would like to basically hear what we thought. I haven't done, my seizures aren't seizure free, so I couldn't answer that one. There's not much I've done besides stop smoking tobacco, so I can't tell so far because the furthest I made it apart was 3 months. So I'm on 2 months so far. So hopefully that was it. And tobacco, I mean, nicotine is what I didn't need. Sailor Mom, Rick?
So with me, so I had previously done an elimination diet to help other health issues, and my new neurologist had suggested the same diet. I said, "Hey, that's great." So I personally have done carnivore as my elimination diet, got rid of arthritis, got rid of a whole bunch of things, inflammation, et cetera, et cetera. I know it's not for everybody, but find out what's causing inflammation and what your triggers are. Um, I've been feeling okay. I had a seizure a few months ago because I wasn't really diagnosed with epilepsy until a few months ago. So I guess a lifestyle changes. I'm medicated and I'm also more aware and I make sure everybody else around me is aware. So that's another lifestyle change. That way I don't freak people out and I don't wake up with, you know, police or anybody trying to give me Narcan because I had a seizure. So that's a big lifestyle change for me is making people aware and being an advocate.
The next one.
I'm not seizure free, so I can't say. I tried keto, it did not work for me. Had some side effects, so I don't know. I mean, I did all those other things: sleep, stopped working, lowered the stress, all kinds of other things. But so far, not yet. Anyway, I'll be quiet now.
This one says, do you live alone? I've been having seizures since I was 10 or 11, and I'm 32 now, and I've never been able to have my own place. I've moved in with a couple of partners, but as soon as we break up, I have to move back with my mom. I get along with my mom more than anyone, and I love living with her, but I have never been able to have my own place because of this damn condition. I've been starting to wonder how many other epileptics actually live alone, and if so, how do you do it? Is your epilepsy more controlled? Do you have a medical alert animal? What's your story? I don't live alone. Um, Personally, I don't suggest living alone. So with epilepsy, I don't suggest, living alone it's out right now. Anybody here live alone? Oh yeah, Jeff lives alone. How's that going?
Well, it's weird. Uh, I've been married for so long, for 38 years, and just recently, I tried living alone. Uh, I liked certain parts of it. I didn't like certain parts of it. Uh, I didn't really have, I don't have tonic-clonics usually, so it wasn't a big deal that way. I have focals while I'm sleeping or while I'm awakening, as the doctor tells me. Uh, so it's never really been a dangerous thing, although I did fall out of bed once and hit my head on the night table. I kind of prefer it because where I am when living alone is where I love. And, you know, I just don't love in Pennsylvania where I am now. But I love the desert and I love California. And that's where I want to be. I think if I had tonic-clonics, like you guys during the day, I probably wouldn't feel safe. And I wouldn't want to live alone. Okay, done.
Okay. Yeah, the next one is something I think we all agree on. Oh no, I thought it said something else. It says Kepra giving Molly like euphoria. I have post-traumatic TLA from car accidents. For years after them, I started noticing I care less and less about music, going to raves, etc. But they happened. I was a hardcore raver and lived and died for music. I even made a living producing music, luckily. But as time went on, I started to not understand music at all. And I only listened to it in car rides, playing, etc. But I've never truly enjoyed it. Anyway, I'm newly diagnosed after telling my doctor all these things, all these exact things. They were like, yeah, that sounds like epilepsy or at least brain damage. So now I'm on a new dose of Keppra. They just increased me to 2,000 milligrams. And while it does make me supremely sleepy, I also noticed I somehow feel like I'm on Molly, like high on it. When I listen to music, now it makes me feel like I'm having an orgasm and it's like spiritual experience to me. I've never felt this way in my life, to be honest, at least not to this degree. I don't know what to make of this. Is anybody going through this? I haven't experienced that. When I was taking Keppra in my teens, I was running the streets, so wasn't paying attention to Molly high. And I've never tried Molly, so I wouldn't know.
I think I might be the only one who gets euphoric seizures, and I won't comment on the not safe for work part, but yeah, that too, almost to an uncontrollable degree. So those are probably seizure related, and if you're on Keppra, maybe it's having a paradoxical effect on you, or you were having it before and it's reducing the seizures, and you're just now noticing because the worst parts are out. But I say enjoy the euphoria while you can, but maybe talk to your doctor about those two situations. Either increased seizures in a different kind, or you're noticing them more. But it wouldn't hurt to try a different one to see if it still happens if you really want to get rid of that, which I don't know if I recommend.
I know I had the opposite effect with Keppra. Like it gave me like the opposite of I've done Molly before, but it is the opposite feeling of that for me. Um I do have auras where I get this uncomfortable feeling of like overjoy, but it's not like a good overjoyed. It's just uncomfortable substances. Yeah. But I just had a friend named that was all. But anyways, sorry, my brain is really lacking today. The Keppra almost put me into more of like a psychosis. Like it would have me because I already have like some, no, not mania, because I have BPD, but it would put me in like a really like Keppra rage, but like really, really like subtle in a way, but it's there, and I'm having these really intense thoughts that I don't, it's hard to explain it, but it's something like, especially when I'm on my period, and I know we talked about that last time, but it like I showed up somewhere with a knife, and I just don't remember really putting that together, and I was starting Keppra, and I've never really done something to that degree, but that's just not who I am, so it kind of has like this alternative effect on me where it wasn't euphoric, it was more like almost like a distorted euphoria where like I was happy to be insane almost. I don't know. That makes sense, or wait.
Yeah, that was really good. I do think that those might be one and the same. Because after the euphoria, I get a very bad feeling. I mean, it almost like what you're describing, not what you're describing doesn't matter. But the like whether or not it's giving you euphoria or what you just described, like almost like a version of that, but I can't think of the fucking word. Whatever the word is. Man, I do think the aftermath of it is bad, like you were describing, even the euphoria. Yeah.
It sounds a little bit like mania. I had a friend that was manic depressive, and that, that's the cycle she would go through a lot. Just before she got therapy or meds or whatever. I mean, before she was diagnosed. So just throwing that out there. I'm not sure though.
I agree. I still need the therapy aspect. We're still getting to that part. So that's
We all do,
definitely
right? That's
you
why
can't
we're
treat all of
here.
us. Yeah.
Please take your medication as prescribed or whatever works for you. We're not doctors.